Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune, and today I'm going to tell you what is the meaning of the third trimester of pregnancy. Maybe you're pregnant and your doctor mentioned this term that you're now in the third trimester and you're confused as to what it exactly means, so I'm going to clear that up today. So what is the third trimester? For you to know, pregnancy is divided into three trimesters. The word tri means three and trimester basically refers to 3 months. This is because the normal pregnancy is usually 9 months long, and so it is divided into bunches of three, which are called trimesters. So the first trimester refers to the first 3 months, the second trimester to the next 3 months, and the third trimester to the last 3 months. This is basically the final stage of pregnancy before delivery. It spans from week 29 all the way to week 40 of the pregnancy, and the baby gains weight rapidly during this time, preparing for birth. So how long does this last in terms of days? So it lasts about 84 days from day 197 to day 280, which is the end of the pregnancy. It covers pregnancy months 7 through 9, that means 7, 8 and 9. It is a full term birth, that means a full term pregnancy, full complete development of the child. It normally happens between week 39 or 38 to 40. That's considered to be a full term birth, around week 39 to 40, which is the end of the third trimester. So what are some important things that you should do during the third trimester? So there is something called a group B strep test, which is something that we recommend during weeks 36 to 37. This makes sure that your vagina is not colonized by a bacteria called the group B streptococci, or you're not already infected by this bacteria, because this can infect the baby during childbirth and can cause a lot of problems. Next thing you have to do is that you should keep all the things ready that you would require if you have to visit the hospital for your delivery. So prepare your pregnancy bag, add everything that is required in that. Make sure that there is someone available to take you to the hospital as you near the delivery. This is the last stage of the pregnancy. Your doctor may still ask you to do a couple of tests to make sure that you're healthy. These could include things like your complete blood count to make sure that your hemoglobin is good. Also a few other tests. If you haven't already had your blood group test done, they'll ask you to do that, and a couple of tests to monitor you for routine infections to make sure you don't have any urine infection. So these could be done in the last 3 months, although most doctors will have already asked for this in the first 3 or the subsequent 3 months of the pregnancy. So this is the time when you just need to prepare for your delivery. So what are the changes that take place between week 29 to 32 for your baby? So your baby can now open the eyes wide and it can also blink. Secondly, the baby begins to practice breathing movements inside the womb. Next is the toenails become visible on the baby's feet. They are clearly visible now. So what are the changes that take place between week 33 to 36? Your baby can now see and respond completely to light, because anyway it's going to be born soon, so it starts responding to these things. Fingernails have grown to reach the fingertips, and most babies turn their head down ready for birth. So this is the position that the babies take because they are going to be born soon, so they turn their head down. And what happens during the last 3 weeks of pregnancy? So the baby can now grasp things firmly with its hands. Secondly, the skin becomes smooth and pink and with added fat. And lastly, the baby is full term and ready to be born now. And this is the end of your pregnancy.